they also have debilitating feelings and senses of inferiority compared to other people. Hi, Dr. Shawn Nabors, West Michigan anxiety specialist and practice owner of the Anxiety Treatment Center of West Michigan. Today, I would like to talk to you about avoidant personality disorder. Avoidant personality disorder can be viewed as an extreme version of social anxiety. So imagine there's this thing called the social discomfort spectrum. Well, social anxiety disorder would be on the low end of that social discomfort spectrum, and avoidant personality disorder would be on the extreme end or the high end of that social discomfort spectrum. What differentiates the two? Because that will help you to better understand what avoidant personality disorder is. Social anxiety can almost be viewed as a performance anxiety around people. People with social anxiety typically fear being humiliated, being judged, embarrassing themselves. Basically, they do not want to make a social blunder. And if they feel that they might make a social blunder, they may shrink in from that moment and not necessarily engage socially. Or they may be anxious about experiencing social situations because of judgments about their performance socially. On the other end, we have avoidant personality disorder. People with avoidant personality disorder typically have all those things that are found in social anxiety. However, they also have debilitating feelings and senses of inferiority compared to other people. In other words, they feel like they're just not good enough for people, and they fear that people will reject them and criticize them. So, a person with social anxiety does not necessarily have a strong sense of inferiority. They just don't want to socially embarrass themselves. Whereas a person with avoidant personality disorder does have that strong sense of inferiority. So, typically, people with avoidant personality disorder, they will avoid social interactions because they just basically create this narrative in their head that people don't want to be around them, or that they're awkward, or that they're highly rejectable. They typically stay to themselves, and it's a really hard time getting people with avoidant personality disorder to get out and socialize. Extreme introversion is one way to look at it. This personality disorder is very hard to treat. Not a lot of specialists are skilled in treating it. There's not a lot of research on avoidant personality disorder compared to other similar personality disorders and anxiety disorders. People with this condition typically suffer in silence. They don't know that they have it. And if they do know that they have it, there's nothing that's effective to address it. And they just end up spending the majority of their lives or their entire lives in this kind of general sense of isolation where they don't really have strong social groups or support systems. So, if you or someone you know may fit that criteria of what I've explained with avoidant personality disorder, it doesn't hurt to see a therapist and talk about it and see if that's what, may be going on with you. In addition to that, you're going to want to look for someone who specializes in avoidant personality disorder or personality disorders. So, that is avoidant personality disorder. It's heavily under researched, it's misunderstood. A lot of people are dealing with it and don't know about it. As always, thank you for stopping by and take care.